You're listening to Health Professional Radio. My name is Wayne Bucklar, and joining me today is Richard Paterson. Richard's a solution delivery consultant at Electrotek and joins me from Brisbane in Queensland, Australia. Richard, welcome to Health Professional Radio.
Thank you for having me on. It's a pleasure to be here.
It's indeed our pleasure. Now, Richard, Electrotek is not a brand name that I'm familiar with. Can you give us an idea of what it is you do and whereabouts you do it, the geographical footprint?
Certainly. Our business has been operating for about 10 years. Primarily, we started out providing nurse call for aged care facilities, nurse call systems, the supply and maintenance and servicing of nurse call systems. However, what we have discovered is that there's quite a few gaps in the market with off-the-shelf solutions or products in the nurse call domain. So we've actually taken a bit of a different course of action. We have a microelectronics engineer on our staff, and what we do now is we consult with organisations that provide aged care and also healthcare services, and we more sort of round table issues that they're having and work out electronic solutions to help them deliver their services more effectively and more efficiently. So we're more of a solutions provider rather than a product provider. The product is the solution, but we create the customised solution for a given situation.
Yes.
Does that make sense?
It does indeed. And in the good old days, nurse call was just a button on a wire and a light outside the room. But in more recent times, in the world we live in, of course, that's expanded to distress and location systems and all sorts of things. So I guess you're able to provide products across that whole range of what would we call it, staff location systems, I guess.
Yes, absolutely. In fact, we've found in the last couple of months just monitoring our search engine optimization on our website and looking at the popular searches, there's been an incredible trajectory upwards of people searching for staff duress solutions.
Yes.
In the aged care environment and in healthcare as well. The issues are probably outworking similar, but the origins are probably a tad different. Mm. What we're finding is with the massive increase in the incidence of dementia, the secure units in aged care facilities for dementia residents in that domain, the supply is way shorter than the demand. Mm. So we've got a lot of dementia residents in mainstream aged care facilities and in the wings, just in standard rooms. And what that's done is, because of the nature of their condition, that a lot of the staff are actually getting physically attacked and harmed in the carry out of their duties. So that's an area we're getting a lot of inquiry for, and we've now developed some quite significant specialised solutions to sort of mitigate that staff danger situation.
It's going to be, I think, a growing issue of the way in which we use electronics to increase efficiency, particularly in aged care, because you look at the population bubble moving through, and for the next 40 years, this is going to be a big growth area and a booming problem. And to make matters worse, of course, it's all the Generation X people who are running the system now for my generation, which are the baby boomers. And we've had a good all our lives, thank you very much. We've had, everything we've ever wanted, from supermarkets to pills to keep erectile function working. We've demanded it, and the world has produced two of them. So now that we're going into aged care, I expect the baby boomer generation will be just as demanding and just as difficult. And, of course, it'll be a boom time because there's so many.
Absolutely. And the trend currently and the way forward in aged care is definitely a focus on providing a living experience. It's not just about providing good nursing or medical care and support in aged care facilities, but it's actually the sort of competitive edge of aged care providers now is to focus on the whole, the sort of holistic living experience for residents, and that's the competitive nature of the aged care sector as we sit now, and increasingly so as we move forward.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and I've been in conversation with Richard Paterson, who's the Solutions Delivery Consultant at Electrotek, and we've been talking about the Electrotek range of nurse call systems and duress alarms and similar. Richard, my favourite question in every interview has to do with misconceptions. It must be my perverse nature. There are misconceptions in every occupation, of course, and in every endeavour. What's the biggest misconception about your products and services that drives you nuts and keeps you awake at night?
What absolutely drives me nuts is the amount of money that is wasted in our sector with incumbent nurse call systems being removed and replaced with a new system. When and the excuse is often that they need to come up to accreditation standards and so forth.
Yes.
But the field devices, like the call points and the things that are sort of hanging off the brain of the system, generally are pretty bulletproof and they're pretty robust and they're fine to leave operational. Our approach is to work at the head end and upgrade the head end so that it brings it up to the sort of contemporary standards, and that can be done at a serious fraction of the cost of replacing a system. We just heard recently about a facility that spent I think about $400,000 to replace the nurse call system, and we had conversations with that site earlier. We could have brought their system up to standard for about $50,000 because it was just a head-end problem. With all the call points, it didn't work perfectly. In fact, they're kind of bulletproof and they're quite robust. So that's the thing that frustrates me, and to me it's much more responsible to spend that money on increasing the living experience and the service delivery to the residents that live in those facilities, rather than replacing something that still effectively works. It could be just upgraded at the brain end of it, give it a bit of a smarter brain, and then bring the functionality up to standard. I'm very passionate about that.
Well, we do have a big percentage of our audiences in aged care, and with a little bit of luck, we'll help dispel a little bit of that misconception today. And I'd like to think your phone will be ringing off the hook. But speaking of phones and ways to get in touch with you, what's the best way for people who want to get in touch with you, Richard?
The best way would be probably via my mobile, because I'm out and about a fair bit, and I'd love to engage with anybody who just wants to have a conversation about challenges that they're facing. And my mobile number is 0403 588 417, and that's probably the best way to get in touch with me, because I'd love to have a conversation about any challenges that people are currently experiencing.
So if you're looking to get in touch with Richard, I'll give you that phone number again, because I'm always getting into trouble for not giving people enough time to get their pencils ready. It's 0403 588 417, and there's more information on the website at www.electrotek, that's all one word, ELECTRO, electrotek.com.au. If you've missed my conversation with Richard Paterson, Solutions Delivery Consultant at Electrotek, the good news is we have a transcript on our website at Health Professional Radio, or you can also listen to the audio archive on both YouTube and SoundCloud. Now, the links to all those are available at the station's website at www.hpr.fm. This is Health Professional Radio. My name is Wayne Bucklar.